It's a real honor to be here. And I just want to say that the Fleming Initiative shares a history with the Nobel Prize because 80 years back from tomorrow, Alexander Fleming received his Nobel Prize for the discovery of penicillin that he made in his very messy, untidy laboratory in London, where we work and where we are sited. But this discovery depended on collaborators as well for the production, the purification, and also the determination of the structure of penicillin. So Florey and Chain and Fleming got their Nobel Prize in '45 at the same time as Dorothy Hodgkin was working out the structure. She got her Nobel Prize later. But this discovery and the production and the subsequent development of antibiotics that were based on this collective endeavor changed healthcare forever. It ushered in a golden age of healthcare, an incredible resource that had an impact on survival. But at that same Nobel Prize ceremony in 1945, Alexander Fleming warned about the problem of resistance. He warned that exposure to sublethal doses, antibiotics, would drive resistance. This is Darwinian, it's evolutionary. We heard a little bit about that earlier today. But what I want to flag, it's not, inappropriate, appropriate. It's any exposure to an antimicrobial will drive resistance, and we need to remember that. And antimicrobial resistance, AMR, is enormous and it's growing. It's a major health crisis, but it's a crisis that's unevenly distributed across the world. It has an incredible price in terms of fatality and death, which is growing and growing. It's 1.27 million deaths a year directly attributable to resistance. But this is growing to over an estimated over 8 million by 2050. As well as the huge toll on life, it's also got a huge economic toll as well globally. But what we need to realize is, going back to the kind of inequity of this, it affects mostly those in low and middle income countries, but it also predominantly affects our very young, our neonates, our elderly, and any of us who are severely ill. But we can do stuff. This is not a problem that we can't address, but we need to address it together. Firstly, the importance of preventing infections to begin with is absolutely fundamental, so that we do not trigger the use of even more exposure to antimicrobials. So to have adequate water and sanitation, to have adequate infection prevention and control within our healthcare systems so they don't amplify and transmit infections, and to have vaccination programs, these are fundamentals and have a major impact on what we do in terms of minimizing the threat of antimicrobial resistance. We can also think about how we can use our antibiotics much more effectively. How can we maximize the effectiveness of our existing agents and also any that might come along later? And how do we also ensure that there's access to effective antimicrobials? How do we ensure that the people who need them get them when they need them to treat the organism that they have? We also need our diagnostics to guide us how to target infections, what anti-infectives to use, how long for. How can we use our diagnostics also to generate data that will inform surveillance? And how do we minimize exposure in healthcare, which I've described, but how do we also minimize it across our food chains, livestock, and our environment? But above all, to do this, we need societal engagement and awareness. And we all need to treasure them. We all need to nurture them for our own use, for our family's use, our community use, and for societal use. And that photo at the bottom is a clip of a hacking of the Piccadilly lights in World Antibiotic Awareness Week, where there were individual stories of people thanking antibiotics for what they've done for them. And it was a pretty amazing bit of social engagement. So At the Fleming Initiative, we are looking at all of these challenges across science innovation, across informed policy and economics, and public engagement and involvement, which is critical. Working across these three pillars, interlinking them to honor the legacy of Alexander Fleming and his Nobel Prize, to address the complex crisis of AMR, but to protect and preserve antibiotics for us and for future generations. Thank you.